Hello, everyone. Today we're going to talk about communication and working as a team in the current landscape. I am Naseem Chatiwala. I'm a physical therapist and a course instructor and developer with Summit Education Professionals for their courses on stroke recovery and vestibular rehab. So, what is communication? It is the part or imparting and interchange of thoughts, opinions, information by speech, writing, or signs. So, how is the communication done usually? So, most of it is spoken, and spoken has the words has the most content of what we speak or what we communicate. But one of the research showed that 93% of the communication is not affected just by spoken words, but it is affected by the body language, attitude, and tone. And I find communication as the biggest hurdle in the workplace, right? We are always complaining about communication from managers to the employees, managers complaining about communication lack from the employees back to the managers. So I think we all talk about this big gap in communication, and it's at all levels. And so, like anything else, if we want to address the communication gap, we need to work at all levels as well. So 7% of the meaning or intent is based only on those actual spoken words. And as I said, 93% is by your body language and by the attitude. This was an interesting study that was done, which showed that for a patient to be in a hospital for 4 days, they may interact to up to 50 healthcare employees. So if you think about it, that's a lot. And think about all the interactions and all the communications that they may have done. And sometimes this is one of the big things that I find with my patients is if they are seeing a physical therapist, an occupational therapist, a speech pathologist, a nurse, a doctor, they'll be like, I hear mixed information from all of you. And sometimes we are all not on the same page in terms of communicating with our patients and what can we do or how can we do to make this better. So there is this really nice analogy which was given by James Reason. It's called the famous Swiss cheese model. And when I first heard about it, Swiss cheese, medical field, I had big question marks in my head. I'm like, how is that analogy working? But it's very interesting, the analogy, because the Swiss cheese, right, it has all these little holes. So basically, what it is hazards getting into prevention mode so that we prevent life losses or human losses. And the way those hazards are stopped from passing through one system to another system so they finally reach the patient, we want to make them less and less as much as we can. And the big thing about this model is communication. How the communication can go from the emergency room where the patient shows up into the OR or to the nursing floor or to the rehab floor to the outpatient to the home care. And all we're trying to do is if our communication lines up, we prevent weaknesses from passing through and ultimately causing harm to our patient. So the goal of this whole Swiss cheese model and the way we think about it is we want to really have that reliable, standardized communication process so we eliminate errors or we eliminate those errors passing through these holes or the holes lining up so the error passes from one end of the Swiss cheese to the other end. So when we have this model of communication, what are we trying to do is if that communication arises from the management and they pass it to the recipient understands and takes ownership of that information. The sender knows when the recipients took ownership of that information. So the recipient has to inform back to the person who started that communication that, okay, I have got this information, I'm going to act on it, I have an action plan, or I'm going to pass this information to the next person. And that's where that message accountability sets in. And all these steps are really, really important in that successful communication. Now, when we work as a team at the hospital or any rehab setting that you are in, we are always thinking about working in cooperation. So we are all these people in this team, co-workers, We have the common goal, and we are all working towards that common goal in this nice cooperative fashion. But we are still working in our own silos. We are working together, but we are still working independently, individually towards that common goals. That's where that collaboration comes in. So collaboration is a little bit more than cooperation. Cooperation is a key dimension of collaboration, but collaboration is where now in the team we work together in terms of I know somebody else's weakness, they know my weakness. Similarly, we know each other's strengths. And so, in that collaborative effect, we are working on building up those strengths of each other towards our common goals, and we are helping each other along the way. Same thing is with multidisciplinary and interdisciplinary. So, multidisciplinary approach, which came in, and we are all very fortunate to be working with this really enriched healthcare professions where I'm a physical therapist. I work very closely with an occupational therapist, with a speech and language pathologist. I work very closely with nurse practitioners, with doctors. So, this multidisciplinary approach towards the patient is we all are coming together and working together with the same goal for our patient. But then the newer concept came in, which is interdisciplinary. So interdisciplinary approach, what did that take is instead of working together in our own silos, which are own boundaries, what did we do? We blended the boundaries. So in interdisciplinary approach, now we are again working towards the same common goal. Patient is always patient-centered approach. But here we have blended the boundaries. We are not working in the silos anymore. And then one more newer approach that came in is transdisciplinary. And transdisciplinary is we are really kind of working, overlapping on each other. We are transcending those boundaries and we are working towards, we're not contradicting anybody's thought processes or assumptions. So we are really trying to work together in the technology. We are overlapping our goals, and so that we are all really working with each other, helping each other out. And in this newer landscape, that's what we really want to do is we really want to work in that transdisciplinary approach. Now, going back to that communication and some of the hurdles for an effective team collaboration, right? This is a picture of this giant elephant. And even though we are all a team, we are working together based on where we are and what we are seeing, there could be a chance that we are not all communicating the right thing. So some of the hurdles arises when we have inattention to the results. We don't have accountability. So the individuals in the team fail to show that accountability. They fail to show the commitment towards that bigger object or bigger project. There's a conflict of interest. So all my teammates, and if there is a conflict of interest where I don't want my other teammate to have something better than I have, then that would also bring this team collaboration down. And then trust. I think trust is the biggest thing in this pyramid, because if there is no trust between the teammates, between the management and the employees, then you cannot work in this nice team collaboration and the communication cannot be as effective. Now, when we talk about communication, depending on what discipline you are, so sometimes as physical therapists, we might be trained to communicate certain way. If you are a nurse, if you're a doctor, we all get trained. Even though we are all in a healthcare profession, we all train differently in terms of how you are going to communicate. And in order to have an efficient, powerful communication, we really want to have some kind of standardization towards communication. So this is just one example. SBAR. It's a very effective communication for grant rounds or for patient rounds. So where we come in with a patient problem, situation, we talk about the background of that patient, we do a quick assessment of what that patient has, and then quick recommendation. Sometimes if you're really efficient and effective with this approach of communication, you could go 5 minutes, one patient, and then another patient, because efficiency, time management is the biggest key factor for any successful operation. Similarly, there are many other ways in which you can have that efficient, standardized communication. And that's again a team collaboration. As a team, you need to come out with a way which works for everybody on that building and efficient communication. So communication is not just about talking and speaking and body language. That's the big components of it. But communication is also about listening. And if somebody's coming to you with a problem, it's not necessary that they want a solution to the problem, but they want you to understand that problem first. So most people do not listen with the intent to understand, they listen to the intent of reply. So if somebody's coming with a problem, my first brain is thinking is, how am I going to address this? What is the action plan? But that takes away from you being that active listener in terms of understanding the problem thoroughly. So I really encourage you to have this intent to understand before you think about the solution or reply. And that brings us into this reflective listening. So reflective listening is where when a speaker is speaking, you listened with that understanding, but then you're telling back or you're communicating back in terms of what you understood from that communication. So that's a really nice process of that attentive, active listening followed by reflective listening. This is a saying, right? We have two ears and one mouth. So we really want to listen twice as much before we speak. Um, Try not to be distracted when you're listening. A lot of times we have this self-talk, self-chatter, where our minds want to go away and start thinking about something else. So really encourage you is if you are participating in that active listening, in that reflective listening, we are really trying to shut off this brain chatter or self-talk as we say it. Now, how can an organization help you with better communication? They can help us in many different ways. Establishing a company culture. So you are establishing values. You really want to make an environment very supportive. You want to encourage your employees versus demand a task completion from them. Participation of your employees into your task, so that the participations, your employees have a voice in that decision making process. It really gives them that autonomy, and that autonomy will help them do better when they are dealing with the task. It also helps create a new source of ideas. And then as an organization, if you really bring out that professional image, branding, vision, if you have a clear vision, then you're really bringing your employees to address quality, integrity, and give the best performance. Communicating in the new landscape. And this really, right now, with the pandemic that we are going through, I think it's really thinking about creative ways on how we can communicate better with not just our co-workers. I just was looking at a news channel where one of the co-worker in her Zoom meetings with all her employees, she would dress in a different character every day, just to kind of bring in some humor into those meetings. So I think we all are dealing with stress different ways, and communicating in this new landscape has definitely been challenging for a lot of us. And we need to really, again, have that growth mindset, think about creativity, think about what's the best you can make out of this situation. So we always talk about bedside mannerism. When we are working with our patients, we are always talking about that body language, that attitude, empathy, how we are showing things, how we are thinking about patient, how they are working or how they have symptoms just by looking at them. So how are we able to do that on screen side? And so the screen side mannerism is as important as bedside mannerism. So definitely they are saying about is how you should look your best. Really need to have an area which is clutter free. When you're working with your patients, you need your one-on-one full attention with your patients as you're talking to them, because patients still expect you to have that empathy. Patients still expect you to notice or recognize any symptoms that they may be having. And it becomes really hard when you are not with your patient in the physical environment, but more in the virtual environment. So screenside manners just want to make sure that we are focused, we have our full attention to our patients, and we are able to address any of the concerns that they may have. Thank you for your attention, and thank you for listening.